My name is Ayodokun Adeton. I will be taking you TAU NSC 413, which is a Expectant Family Care Project. Objectives. At the end of this course, the students should be able to identify an expectant family for an in-depth care study. They should be able to discuss the family experience through pregnancy, that is, how is pregnancy is to the woman, explaining the labor, the first stage, second stage of labor, and the period. Then you should be able to assess a woman during these stages and provide focused antenatal care, and to be able to conduct normal deliveries and provide good care. Expecting family is a family that is anticipating the birth of a child. That is, they are eager, they are planning to have a child in the family. Then the journey of having a baby is proven effect, which means they need to plan of having a child. How are they going to take care of the baby? Then the mother before delivery. There has been increasing recognition that a woman's health status, lifestyle, and history prior to conception strongly influence the achievement of a healthy pregnancy outcome. That is, during pregnancy, the lifestyle, the diet, the nutrition of the mother will help to achieve the healthy pregnancy very good. Then maternity services strive to provide care that is not only safe but easily accessible and is responsible to women's individual, linguistic, faith, and cultural needs. Then this enhances maternal and infant health outcomes. Then foster emotional support and strengthens family bonds, encourages active participation of family members in care, then positive responses from the body, from the baby to his parents, reinforce parental attachment, and stimulates good interaction. Health history taking and physical examination is very, very important. The past history, the present one is very, very important to achieve a very healthy mother and baby. The menstruation history, which is very, very important too, that is the LMP, to determine the ED, the expected delivery date of the mother. And the obstetric history, is it the first pregnancy? Is there any abortion before? Is there any history of delivery? Is it bad? Is it good? How smooth it is? It's very, very important in taking care of pregnant women. The investigation will help us to know, is the blood okay? Is there an infection with the mother? So that we're able to tackle it, to treat it before delivery. Medication, is the mother is on any maintenance drugs, then the multivitamins to help both the mother and the baby. The monitoring fetal development is very, very important. That is why we need to tell our patients to come always for antenatal clinic and follow up. And if there is any challenges, if there is any changes in their body before the date given to them, they should come to the clinic for follow up. Postpartum assessment, that is after the delivery, you need to check, is the uterus okay? Is there any bleeding? Is there any abnormal smelling? Is there any discharges? And newborn evaluations. Is the baby okay? Is abscess gone? Okay. Is the baby feeding very well? Newborn evaluation is very, very important. Then we need to understand the family experience through pregnancy and childbirth. What is the experience of this woman during pregnancy? Then the experience through pregnancy and childbirth. Then assess women during pregnancy, labor, and puerperium. Then demonstrate skills in newborn care and patient-infant interaction. Promote exclusive breastfeeding. We need to address our patients that for the first 6 months, no water, no drugs. That is exclusive breastfeeding. Then tackling inequality is high in the public health, and the midwife has an important role in targeting pregnancy women. Then pregnancy stages overview, antenatal. That is, I've already talking about that before. Regular checkups and monitoring. Then labor, stages of labor. How are we going to first stage, second stage, before fully for the patient to deliver, and pain management so that the patient will not experience pain. Then puerperium, recovery phase for the mother and newborn care. Then conduct normal deliveries. Apply universal safety precaution in postnatal care to avoid infections. Then care for newborns and encourage parent-infant bonding. And these are the stages of delivery. Initial latent phase, then active phase, that is stage 1 is latent phase with active phase. Then stage 2, there's crowning of the head. Crowning of the head in which the baby will be delivered. And stage 3, delivery of the placenta. Then we need to examine the placenta. Is it complete? Is there anything inside the uterus? We need to run and check the placenta under the running water to know that the placenta is complete. Then standardized nursing care plan to know, are we going to reassess back the patient or our evaluation is okay. The nursing and midwifery logbook where we document everything, and importance of accurate documentation for continuity of the care. Non-documentation means not done, and documentation means done. We need to document everything for the patient. Then addressing cultural differences in family dynamics. Some family, they will tell them don't eat salt after delivery, don't eat snail, don't eat okra. We need to address cultural differences in family dynamics. They managing high-risk pregnancy and complications. That is to check the BP to avoid fit during and after pregnancy. Then ensure effective communication among family members and healthcare provider. That communication is very, very important. Then case studies, selecting and expected families and establishing rapport, conducting interview and observation, documenting findings and presenting case study results. The importance of linking families to community support services is very, very important. Resources available for expectant. Resources available expectant families. Parenting classes, support groups, continuous education and training for midwives is very, very important to know what is trending for the midwives. Incorporating technology in expectant family care. Then, in conclusion, women can choose from a variety of midwifery options. Introduction to midwifery care is crucial in forming our initial impressions of the maternity service. The introduction to midwifery care is crucial in forming of the maternity service. Information is shared between the woman and midwife in order to discuss, plan, and implementing for the care of the pregnancy, the birth, and postnatal period. That postnatal period is very, very important too. Thanks for listening. If there is any question, you can drop it.